met with Director General of the World Health Organization, Tedros Adhanom, who praised Egypt's successes in the field of health and expressed gratitude to President Sisi's efforts, initiatives of supporting women's health and 100 Healthy Lives initiative. Here is a joint press conference by Dr. Zaid and WHO officials.
We welcome organization for whom we held in Egypt holds in great esteem for the sustainable support to Egypt's initiatives in the area of health. He said, His Excellency has said that Egypt's initiative for public health awareness has been the biggest in terms of scale and in terms of quality, because this initiative has been the largest in the history of mankind. His Excellency has also discussed with President Abdel Fattah al-Sisi the overall system for health care. All issues having to do with healthcare have been discussed by His Excellency, the World Health Organization Chief, and President Abdel Fattah al-Sisi. We have been discussing with the World Health Organization Chief all procedures, all scientific procedures, starting from the scientific approach of conducting scanning, conducting surveys, down to the smallest detail, all having to do with all issues pertaining to public health and family health care have already been discussed, and actually this has given Egypt credibility. Dr. Tedros, who is the chief of the World Health Organization, is an African personality who has been held in great esteem, and we are proud of him. We are proud of him because he is an epitome of a successful African career personality. It has been a great opportunity to work with His Excellency, the World Health Organization Chief. Thank you very much to Dr. Tedros, the World Health Organization Chief, and for sustainable support given to Egypt by the World Health Organization, as well as all. Thank you very much. Well, let me welcome His Excellency again.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you also for this opportunity.
I'm here today because I'm here to discuss with Your Excellency the news of the study which we have already conducted, which is the initiative of 1 million health. I met this morning His Excellency President Abdel Fattah al-Sisi. I met His Excellency President Abdel Fattah al-Sisi by late June, last June, and one evening when meeting with President Abdel Fattah al-Sisi, we discussed. He approached President Fattah al-Sisi on that evening. Approached me on Egypt's intention, on Egypt's willingness to launch this 1 million health initiative by Egypt. We talked about the initiative itself. Some of the African leaders came to greet His Excellency President Fattah al-Sisi because we met him on the fringes of the African Summit in June, and they were happy. They were so happy that President Fattah al-Sisi was so committed to raising the standard of healthcare in his own country. And as a former health minister myself, I realized what it means to be committed on the level of leadership. This great commitment, as shown by President Abdel Fattah al-Sisi, and the large, massive campaign launched by His Excellency in the area of public health All these efforts have been an epitome of his commitment to raising public awareness and public hygiene. 60 million people, 60 million Egyptian people have been scanned for communicative and contagious diseases. So I dare say that this campaign has been a great one. I'm so proud that the World Health Organization has been an active partner with Egypt in launching this campaign for fighting virus C virus, liver virus, hepatitis. You know that there has been an initiative to eliminate hepatitis C, by the year 2030. Actually, Egypt has almost managed to eliminate hepatitis C altogether in Egypt even before the year 2030, which is the deadline set by the World Health Organization. The World Health Organization believes that Egypt could manage to exterminate altogether hepatitis C even before the year 2030. We highly evaluate all the efforts made by the Egyptian people and the Egyptian government, as well as the great healthcare programs spearheaded by Egypt. I've also noticed that there has been a balanced vision between the Ministry of Health on the one hand and the World Health Organization, and this is very important. This is a very important element for the success and for launching initiatives, either. So today's 1 million health initiative has expanded to include not only hepatitis C but as well as all chronic diseases like cancer, liver, all hypertension, all other chronic diseases which have been there for years.
حدثني أيضا أن البرنامج لا يتعلق فقط بالأثرياء وإنما يتعلق بصحة المشاكل التي تواجهها عامة المصريين عامة.
We have our talks with President Abdel Fattah al-Sisi dealt with all the issues having to do with all urgent healthcare problems. We tackled all problems which the healthcare system in Egypt has been facing for years. The President actually now health surveys could provide us with a wealth of information about the number of patients and the kind of diseases rampant or spread in the country. It's important to tackle problems. In order to provide information is so important.
يساعد في اتخاذ التدابير اللازمة لمعالجة المشكلات ولكن ليس الأمر فقط بالأمراض غير السارية ولكنه يتعلق
So this has nothing to do with not only with chronic diseases but with all other healthcare problems such as cancer, breast cancer. More than 28 million Egyptian women have been scanned, have been surveyed for breast cancer, have been examined for breast cancer. President Abdel Fattah al-Sisi explained that the program would even expand further to include more women and more people to be scanned for such chronic diseases. We also tackled children's malnutrition, obesity. So in some countries have been suffering from malnutrition. So it's important for Egyptians to provide health care for children for the future of the country. I'm really dazzled. I've been really dazzled by the way Egypt's President Abdel Fattah al-Sisi and Egypt's government have been tackling the affairs of the country, reform, development. Actually, Egyptians do pin high hopes on him and the efforts made by the Egyptian government, and maybe in the future we'll be learning from the Egyptian experience. And we have seen, I've had the honor I reported on the first phase and second phase to President Abdel Fattah al-Sisi and presented to him the blueprint we have been working on. Actually, hundreds and hundreds of hours have been spent by World Health Organization officials. They have been making field tours across the country, across the nation, to see for themselves, to get first-hand knowledge of all health problems. And this is a report, what we are showing you here today is a report by the World Health Organization which shows the entire world how Egypt has successfully managed to scan and to examine its people for all dangerous diseases and all diseases have to do with women and children. Thank you very much to you all.
And then I will add a few points. All this packaged in, as you know, universal health coverage.
Of course, all these issues have been gauged, and the principle of health care for everybody has been in place for years now. And we have already started with the overall insurance system with the Port Said governorate, and 5 more governorates would be added to Port Said, and I do hope to join the Minister, Excellency, the Minister of Health, with the launch when this program of overall health system was launched. This would be beneficial to all Egyptians. This is very basic. I'm so glad, I'm so happy to listen to hear President Abdel Fattah al-Sisi saying that health care is not only for the rich but for everybody. President Abdel Fattah al-Sisi has been making continued efforts. We do hope to help. This could be applicable not only to Egypt but also to all countries of the region. We have discussed with President Abdel Fattah al-Sisi how to benefit, how to make our African brothers benefit from Egypt's experience. Because Egypt's President Abdel Fattah al-Sisi is now the chair of the African Union for the year 2019, and Egypt's initiative could be applied to all African nations. I'd like to express how happy I am, how happy to be here in front of you to see how committed Egypt has been in launching this massive, greatly massive campaign. And we're going to organize support, and we're going to learn from Egypt's experience, which could be applied to all other countries on the continent of Africa. He mentioned that the overall system of healthcare has been applied for the first time to Port Said, and he would like to join President Abdel Fattah al-Sisi in launching on a designated day. My question to Ahmed, you are most welcome to Egypt. Secondly, after your historic testimony, what's the role of the World Health Organization in making continued communication between Egypt's initiative on the one hand and all other similar initiatives on the other? What we see, we have already seen what Egypt has already done, which can be communicated to other countries. And and we have already given this historic testimony, this report to President Abdel Fattah al-Sisi, and we told him that all other African nations and all other countries of the world would like to benefit from Egypt's experience and apply the same program as Egypt has already applied. Things or affairs do differ from one country to another, but however, we can adjust small details for this initiative to apply to all other countries. This could be the starting point, and we're going to share and promote this initiative of Egypt and apply it. There are some other countries which have been visited by President Abdel Fattah al-Sisi. Dr. Tadros, you are most welcome to Egypt. You have talked to us that you shared your vision with President Abdel Fattah al-Sisi. How can this shared vision be applied by the World Health Organization? How can the World Health Organization give logistical support to Egypt in eliminating hepatitis C? The role of the World Health Organization in all public health initiatives has provided Egypt logistical help in providing the means for doing scanning. For example, in doing the scanning or the surveys for hepatitis C, the World Health Organization has provided Egypt with all approaches and software needed for the campaign. The staff of the World Health Organization, the World Health Organization's office in Cairo, has had its staff tripled its own staff in order to cope with Egypt's growing need and Egypt's growing cooperation with the World Health Organization. Even the World Health Organization has already managed to provide training for Egyptian doctors either here in Egypt or abroad.
So maybe on the global
بالنسبة للاتجاه العالمي نحو القضاء على فيروس سي الذي سينتهي
As for the world orientation towards eliminating hepatitis C, the World Health Organization, the international community has lent support to a number of resolutions in order to eliminate hepatitis C by the year 2030, and the World Health Organization has to provide technical support and to muster and drum up partnerships with all other countries in order to support all of these initiatives. What is going on in Egypt for sure is going to lend more support to these initiatives, because judging on what has been done in Egypt, we could say that Egypt can now share its successful experience towards eliminating hepatitis C and all other diseases with other countries. Egypt is the only country on the continent of Africa to have done so. Of course, Egypt has made greater strides than other countries such as Australia and others, though they have more resources. But however, Egypt's commitment in the area of health has shown that Egypt could do more than even these more advanced countries. Some countries which have already started this campaign: Australia, Iceland, Switzerland, Italy, Mongolia, Spain, France, Georgia, Japan, and the Netherlands, as well as the United Kingdom. All these countries have already started this campaign. But however, Egypt has been the largest country, but it's Egypt which has done greater strides than all of these countries to eliminate hepatitis C. And this is to prove how commitment Egypt has shown shown. It's not a matter of being richer than Egypt. It has nothing to do with being how rich a country is, but it has to do more with how committed the country is. The presence of a committed leadership who can muster all resources and make all resources available. This fact actually will inspire all other countries in order to follow, to take a leaf out of Egypt's book in order to eliminate hepatitis C. Her Excellency Dr. Hala Zayed and Dr. Tadros. I'm Taghrit Hussein from the Nile TV. I'd like to know more about coordination between the World Health Organization and the Ministry of Health in the foreseeable future. Would like to know more about this inspiring story. Can this story go beyond boundaries to all other African nations? Because since we all know that this year, in 2019, Egypt is the chair of the African Union. Are we going to see more cooperation? And Dr. Hala Zayed, we are so happy to see how that the healthcare system has been making greater strides and to know that women's and children's healthcare system is giving more impetus, giving a greater push at your hands. Thank you. On the first thing we have been doing is to document what we have been doing. We have already documented everything we have done. And then comes commitment. His Excellency President Abdel Fattah Sisi, in his capacity as chair of the African Union, has shown we have documented everything, and everything is verified, and we have already invited His Excellency President Fattah Sisi to address the conference to be held by the general. We have invited President Fattah Sisi to address the General Assembly in the spring, this coming spring, because some countries have been stumbling, have been overburdened by financial commitments, overburdened by financial problems. So they would like them to follow suit of Egypt, because Egypt has shown commitment towards its society. This opportunity is going to help to inspire countries and country leaders to make continued efforts of healthcare system, which has been introduced in Egypt and started with Port Said and is going to apply it as well, in addition to Port Said, to Ismailia, Luxor and Aswan as well. And this of course has been another accomplishment. We're going to concentrate on, would like the healthcare system to expand to include every citizen of the people. On Egypt's great commitment, this is going to be documented as well. And all shares and information we have at the World Health Organization would be shared with Egypt's all other 5 governorates, to which this healthcare system would be shared as well. So, on the new campaign on children's and women's campaign has not been exclusively limited to scanning earlier diagnosis of breast cancer, but also included reproductive health, other aspects of reproductive health, obesity, diabetes, and it has to do with all women starting from the age 18 upwards, and every age bracket has its own techniques. We started our women's survey campaign on July the 1st, and the campaign has been going on. It's going to start to further go on to include most or all women on the land of Egypt, not only to scare for an earlier scanning or early examination of breast cancer, but for obesity, for diabetes. diabetes. Every age bracket is going to have its own examinations for life for diseases such as diabetes, breast cancer, starting from the age of 18 years.
مثل هذه الحملات ده اللي ذكره السيد الرئيس في لقائه مع دكتور تدرس ان احنا اكتشفنا قد كده الحملات دي تكلفتها
We have, as Dr. Tadros told President Abdel Fattah al-Sisi, we've discovered that the cost of such campaigns, starting from the early diagnosis and from all earlier surveys, has been much less than we had earlier expected. It costs only $480 million for the public treasury. The cost has been limited to only $480 million. And of course, this will be beneficial, be much to the benefit of not only to women, but to women and to the entire household. Because public health, of course, is going to impact the Egyptian economy, because most of the elements supporting the Egyptian national economy are people who are less in age than 25 years. So, Sarah Abdelbari from Radio Miss, how does the World Health Organization is going to support the health of African women? The campaign. Well, the campaign will be lending full support to women's health because everyone is supporting it. We to organize a campaign which has been so massive and to include almost every woman on the land of Egypt is something which has already been noticed by the entire world with admiration. We have been mobilizing society. We have been mobilizing society outdoors, on television, on the radio. And of course, the World Health Organization have been dispatching its own experts to help us draw up our blueprints and plans for these campaigns. And the World Health Organization has always assumed a single independent position on Egypt, on the continent of Africa, which has not been biased to any country or to any political issue. So all the programs we have been organizing would be shared, as Dr. Tadros said. Egypt is so willing to share all of its successes, all of its healthcare blueprints and programs, to share these with Egypt. Some countries do need, for example, renal dialysis, renal ophthalmology work, then some other specializations, for example, specialities. So, as Dr. Tadros said, the World Health Organization is going to help us to assist with awareness campaign, awareness plans, as well as training as well, personnel training. Because through 100 million health, which is the dubbing of the name of the Egyptian initiative, we do hope to embark on Africa. His Excellency the President has shown commitment towards this initiative, and the World Health Organization is committed to cooperation and collaboration with the Ministry of Health, as well as to assisting other African nations. This verification report which we have already received is the most significant healthcare report, healthcare document. And of course, we all know that every country has its own specificity. However, Egypt is willing to share all of its experience with all other countries. Egypt has shown willingness to share its experience with other countries. The documentation and verification conducted by the World Health Organization will be shared with everyone. Thank you.